with weight loss surgery, you really want to choose a doctor not necessarily based on any ad campaign, not based on a fancy jingle or a catchy jingle. You really want to investigate not only the surgeon himself, but the program that he's associated with. I think a very good first look at a surgeon and a program is by looking to see whether they are part of a center of excellence or not. That's an important designation.
And you can ask for that.
And you can absolutely ask for that. It's a designation recognized actually by the Medicare services, so that's actually by the U.S. government. It's a designation based on volume, experience, outcomes, infrastructure, so that the surgery is being done the right way.
So these are the questions you want to ask.
These are the questions you want to ask.
And when you shouldn't get weight loss surgery, there are people that really are not necessarily suited for this.
That's correct.
Getting it done.
Right. I think a good way of considering this is that weight loss surgery done appropriately is for a certain amount of overweight, and they're very, very clear measures that
you go by the
body mass index. Now, if anybody doesn't know what the body mass index is, it's very easy to calculate. All you have to do is plug in your height and your weight. Typically, a body mass index of 35 is a cutoff for which insurance companies will pay for your surgery. So I would say if your body mass index is too low, for example, if your body mass index is below a 30, and that puts you in a category of just being overweight and not obese, that weight loss surgery is not necessarily appropriate.
Yeah. We have a sports guy here who's had this surgery, and back to his
original weight.
Yes. Why? Why does it not work for some people? Is it because they continue to eat?
Yeah. Unfortunately,
or are they people built this way? That's what they're.
It's a very good question. Very good question. So, unfortunately, there is about a 20% failure rate. Failure being that someone doesn't lose as much weight as they expect, or they regain their weight. And I'm sure a lot of people know others that have had surgery have regained weight. And the important thing is that along with weight loss surgery, habits have to change. A new way of eating, a new way of being active. A good program that we talked about before will include a nutritionist that will teach you a new way of eating. And if someone doesn't change that and doesn't take advantage of this opportunity, the weight loss surgery that can help you change the way you're eating, and if someone goes back to habits where they're snacking on unhealthy foods throughout the day, they're not going to succeed. There's just no way they're going to succeed.
Do you usually consider above 35 morbidly obese?
So by definition, body mass index above 40 is morbidly obese. 35 would be a cutoff of severe obesity, and typically people have medical conditions like diabetes, high blood pressure, and other severe illnesses that go along with their weight. So these are people that really need surgery to help them resolve these medical conditions. And that's really what we're after. Improving health, resolving medical conditions, requiring less medications over the long term. That's going to be life-saving. That's going to be life-saving. Now, people with a body mass index, let's say, less than 30, where the benefits might not outweigh the risks, these are people that really should try these behavioral changes.
Are these procedures too new to calculate what is the average life
not too new
extension?
At all. Not too new at all.
How many years does it add then?
There have been studies that show, for example, gastric bypass surgery extends life. There have been studies that show that people of similar condition, weight and medical conditions, compared one group that had surgery and another group that didn't have surgery and were just medically managed for their weight and medical conditions. They were dying earlier, in some reports up to 10 years earlier than the people that had the gastric bypass surgery. So there are studies with the gastric bypass surgery.
Dr. Korman, Chief Surgeon, Marina Del Rey Hospital. Thank you for being with us here on Money 101. Appreciate it.
It's been my pleasure. Thank you.